This is an instructional video on how to perform pediatric tracheotomy or tracheostomy suctioning. First thing I need to do is I'm going to gel when I come in the room, perform hand hygiene. Next, I'm going to confirm that I have my emergency equipment. I'm going to make sure that I have an ambu bag at the bedside. I have working oxygen flow meter. I have 2 trachs at the bedside. One trach will be the size that the child is wearing. The other trach will be a size smaller. I will also make sure that I have working suction. 100 millimeters of mercury. Working suction. Next, I'm going to confirm I have the patient who I'm supposed to be performing suction skill on. This is Victoria Gonzalez. Mom, can you confirm her date of birth with me?
July 13th, 20XX.
Thank you very much. So Victoria is having excessive secretions in her trach and she's having a little bit of respiratory distress. Therefore, she needs to have some tracheal suctioning. I'm going to perform hand hygiene and I'm going to gather my supplies. I'm going to have a 8 French suction catheter kit for Victoria. I'm also going to gather 0.9% saline. I have a trash can on below and my workable surface. I have positioned myself where I'm going to be able to easily work with my supplies and work with the patient. Next, I'm going to put the rail down. Squeeze and lift up, bring down. I'm going to stay next to her, and I'm also going to have Mom put a hand on the child for safety. Now I'm going to go ahead and open up my catheter kit using sterile technique. Inside the catheter kit is a pair of gloves, the suction catheter, and this plastic will be the basin for which we put our saline into. I'm going to open my saline and I'm going to lift my saline. Next, I'm going to go ahead and take the gloves out of the kit. I'm going to go ahead and put those on sterilely. Giving myself enough room. Now I will be using my dominant hand as my suctioning hand that will stay sterile. I will use my non-dominant hand as the control for the suction and to touch the patient. So I'm going to go ahead and take my suction catheter out of the container. This is my clean hand. I'm going to put some saline into the basin. Next, I'm going to go ahead and connect my suction. Clean hand, sterile hand. Maintaining sterile in this hand, I'm going to check my suction's working. Working properly. Next, I need to make sure that I know how far that I need to go in on the patient for the trach. So on the suction catheter, there are markings. We have pre-measured Victoria's trach so that we need to go at 6.5 centimeters depth. I'm putting my fingers right at 6.5 centimeters depth. Okay, now it's time to perform suctioning. I'm going to have my helper mom go ahead and remove the trach collar, applying suction, and in a rotating motion, I'm going to count to 5. 1, 2, 3, 4, 5. I'm going to ask mom to go ahead and replace the trach collar, and I'm going to clear my catheter of secretions. I'm going to keep my finger at 6.5. I'm going to do another pass because I can still hear lots of secretions. 3, 4, 5. Replace the trach collar. Clear my catheter of secretions. And I'm going to reassess my patient. I'm not hearing any more secretions. She is not having any further respiratory distress, so I do not need to make another pass. So I'm going to go ahead and dispose of my catheter. I'm going to put the side rail back up for safety, and I'm going to go ahead and get rid of my clean hand glove. Now I need to go ahead and perform hand hygiene. I'm going to go ahead and reassess my patient. Her lungs are clear and her oxygen saturations on 1.5 liters per minute of oxygen per trach collar are at 98%. Thank you, Mom, for helping. Thank you, Victoria, for being such a good patient.